Hey guys, so my presentation is going to be on frontotemporal dementia, commonly referred to as FTD, some current treatments of FTD, and citalopram. Alrighty, let's get started. So what is FTD? So frontotemporal dementia is a progressive neuronal degeneration disorder that primarily degrades the frontal and temporal lobes. Which you can see in the image I provided. You can see the majority of the affected areas, the frontal and temporal. And so deterioration in these areas affect things like executive function, personality, and language. Interestingly, FTD is only 10% familial, and then the other 90% is sporadic, also known as like due to chance. TDP43 and C9 open reading frame 72 are two genes that have been observed to be altered in this disorder, which we kind of touched earlier in the semester. It's similar to Alzheimer's and ALS because of the phosphorylated tau proteins detected in the affected areas and the stress granules due to the mutations of TDP43 FUS aggregating. And then there are two subtypes I'm going to quickly discuss of FTD. One is the behavior variant. So the behavioral variant only looks at the behavioral and executive function deficits, whereas primary progressive aphasia has language-specific deficits, as well as comprehension, speaking, and writing impairments. Motor impairments, though, without the behavioral variant and PPA hallmarks, can be seen in people diagnosed with FTD. Next, we're going to look at current treatments. So, sadly, there is no cure or preventative measures currently, but there are some current therapies that focus on treating and diminishing the symptoms that occur during the progression of the disorder. One of those are selective serotonin reuptake inhibitors, which shortened as SSRIs. Those are a specific type of antidepressant that try to increase the levels of serotonin in the brain. They also aim to reduce behavioral symptoms such as anxiety, agitation, apathy, obsessive behaviors, and depression. A second treatment is neuroleptics, which is an antipsychotic drug, and they seem to be beneficial on some behavioral symptoms like psychosis and agitation, but they come with major side effects. So, for example, in elderly patients with FTD, side effects can include increased mortality rate, motor dysfunction, and strokes. The last treatment type we'll look at is cholinesterase inhibitors. They are more commonly used with Alzheimer patients, but it has been shown that naming deficits seen in progressive primary aphasia have decreased with the use of these drugs. A side effect can be worsening the social impairments that are common in FTD patients. Next, we're going to talk about the new treatment drug being studied, which is citalopram. So what is citalopram? It's also an SSRI in the antidepressant category, which again works to increase the amount of serotonin in the brain. So previous research has been done on another SSRI, which is paroxetine, and it works similarly on the serotonergic system that citalopram does. The difference, though, is that citalopram is free from having any anticholinergic effects, while targeting still the serotonergic dysfunctions in FTD. So, although citalopram appears to be safe and effective for treating behavioral and psychological symptoms in Alzheimer's patients, there is little reported evidence of its use in FTD in past research, which is what the article is trying to delve on. So speaking of the article I chose was the serotonergic function and treatment of behavioral and psychological symptoms of frontotemporal dementia, um, which was an amazing paper to go over, super easy to read, and a lot of good information. So let's start by delving into the methods of the study. So the subjects, they were chosen for the study um, from two university hospitals, and they were outpatients. But the outpatients had to be in a good enough, I guess, mindset and to be able to have written consent to participating, or they weren't allowed to participate in the study. They also had to pass other criteria before becoming eligible. They had to score less than an 8 on the neuropsychiatric inventory, so the NPI test. They also had to be free of any other neurological conditions and illnesses. And they also had to obtain a normal biochemical screening, like blood levels and whatnot. And they also needed to not be given psychotropic medication during the study. The total amount of people that were eligible was 15 patients, but only 14 of the 15 entered in this study completed it. One of the 15 started the study but then dropped out early on. So, first, there was a medication washout phase that had to be completed, and after that, the patients underwent a citalopram challenge, which gave the experimenters um, a look at their body's serotonergic abilities. And the way that it was measured was through prolactin levels in the blood. So then the actual treatment phase began the day directly after the citalopram challenge, which lasted for 6 weeks. It was an open label study, so both the experimenters and the subjects knew that what they were receiving and the amount. So citalopram was titrated 10 milligrams per week until the max amount of 40 milligrams or the maximum tolerability to that individual was reached. Blood samples and NPI and frontal behavioral inventory scores, so FBI, were taken at 3 points during the experiment. First, they were taken at baseline before the treatment phase. Second, they were taken at 4 weeks in, and then the final or sixth week. And then the results seemed extremely positive, which we'll go into next. Alrighty. So the results showed a significant drop in NPI scores as well as FBI scores. So figure 1 at the top of the two pictures shows the decrease for the NPI scores. And as you can see, the two areas of the NPI that had the greatest decrease were symptoms of depression, disinhibition, and irritability. And then the second figure shows the FBI score results, and specifically apathy and disinhibition for FBI scores decreased the most. So the study proved that FTD may be more selective than Alzheimer's disease in serotonergic impairment. And then a few limitations to the study were their ridiculously small sample size of 15, the open label design, heterogeneity. They also didn't have a placebo, and prolactin concentration peaks fluctuate throughout the day, so depending on when they took the measurements could have also been impacted. Future studies should definitely repeat this study, but on a larger scale with a double-blind design and include a placebo. Alrighty, so to conclude all of this, FTD, along with other progressive dementias, are tragic for the affected individual as well as their loved ones. So without a known cure or prevention, hope seems slim. once onset begins. Trustingly, though, with promising results like this study, there will be more progressive, there will be more progress in symptom treatments in the near future.